do have some questions in Q&A. Starting with Maitreyi Hegde. The question is whether WHO has any power to coordinate a global network of NGOs directly than coordinating with nation states. Is it a possibility within the scheme of WHO?
But maybe I'll give it a start. WHO cooperates a lot with NGOs. Obviously, they are the essential partners. There are about more than 300 NGOs that participate in the governance, in the meeting of the governing bodies. NGOs are implementing partners in many projects. They are watchdogs, obviously. Third World Network is a good example. They bring the voice of essential communities in public health, doctors, patients, students, nurses, hospitals, and so on. So there is already a common work. Coordination is a big word. You coordinate if you have the authority to coordinate. And I doubt the WHO has this authority of being like a universal global coordinator of NGOs. But I'm not even sure whether it's necessary to think in terms of actual coordination. To me, what's important is the quality of the work done together. Under the IHR, again, WHO can act on information coming from other sources, and NGOs can be a very good source. Professor Legge, I think, did an excellent job of going back to the early ideas of what the IHR should have looked like and how much they were watered down. But again, let's put things in context. The very fact that an international organization can, for example, act on an email from an NGO saying, we are on the ground in country A, and we are seeing people hospitalized with weird symptoms that don't match any disease that should be present now. And the fact that WHO does act and can confront a state with those information, I wouldn't underestimate that kind of power that represents. So again, maybe after working 30 years in the United Nations system, becoming too positivistic and too jaded. But I think we need also a good dose of realism of how much international organization can do. And I think that's been one of the threads across our three interventions.
Yeah, can I respond also, Nithin?
Yes, please.
I value the fact that WHO is a member state organisation. And I come from an organisation, the People's Health Movement, which spends a lot of time watching what WHO is doing. But the two areas where I would suggest we should put more focus in terms of strengthening the role of the way WHO works, firstly is democratising the structure so that the member states can expect that their contributions will be, their budget will be implemented rather than being held in what I think of as a chokehold by the donors. But the second thing is to make the member states accountable for the policies that they promote in secret and in public around public health. So from our organisation, we want to hassle WHO to make them more transparent and make them adopt better policies, but we also want our countries to strengthen their own democracy so that they are paying attention to global health issues, sharing it with their people and coming up with policies which reflect people's needs.
Professor Burci, the next question is regarding towards the negotiation stage of international health regulations and involvement of China. I would like to not probably call it in very short, very narrow way in involvement of China. Probably, if you can reflect upon the entire the situation during the negotiations for IHR, especially scholars like Kamrat Scott has written a lot about it and how post-SARS politics has diluted the thing. So probably if you can explain a bit further on the negotiation stage, what happened during it, it would be very good for the people in Kerala.
Yeah, very quickly. I happened to be there. I was in the legal office at the time. I wasn't the legal counsel yet, but I was part of the team that worked actively on the revision. First of all, as I said, SARS gave the tone to that revision, because the IHR to a certain extent codified what the Secretariat was already doing in terms of dialoguing with states, doing risk assessment, doing some surveillance, using non-state sources, using networks of experts and institutions, both for alert and for response. So it's interesting that there was an attempt to codify what happened in practice, because it had been successful in the case of SARS, but at the same time containing what was seen as a quite striking amount of power on the part of WHO, on the part of the Secretariat. And that in a way, and this again is one of the threads of our statements, and as you know, the tons of literature, both international relations and international law, what is the nature of international organization? What is the role? Are they just agents of member states? Are they more? Do they play an independent role? What are the conditions in which this role can be played? There's a lot of scholarship that in a way reflects a particular view of the world, but I think it has also to reflect political choices and political constraints. And Professor Legge put his finger on the wound when he mentioned the funding of WHO, the extreme reliance on voluntary contributions that intuitively made the Secretariat less enthusiastic about being too critical for fear of losing voluntary contributions, in particular by the big donors. So sorry, I'm digressing now, but the revision attempted to codify good practice to reach what was seen as a politically acceptable bargain between the authority of WHO and the authority of states, certainly watered down many of the things that we in the Secretariat proposed in the initial drafts. And also, interestingly, sort of brought up some of the real priorities in politics, because the public health part was agreed relatively easily, and what remained was security, sovereignty, and trade. So the provisions that had to do, for example, with this early warning on bioterrorism, with again, the balance of the grand bargain were the hardest to negotiate, and were sort of agreed at 4 in the morning on the last day of negotiation. That's why sometimes when you read them, they are a mess, because they are the outcome of very difficult compromise. And so that shows you that the IHR are not just a public health instrument, they are deeply political instrument. They touch areas of international politics that go way beyond health. And that's why that to me is also an element, a challenge, an element of weakness for WHO, because sometimes the decisions about national and international measures are not taken by health ministries, which are typically the constituency of WHO. They're taken by defense ministers, by trade ministers, by prime minister, by president. And so the challenge is how to reach an element of coherence and coordination among these different sectors. But this goes way beyond WHO and way beyond the IHR, in my views.
Nithin, can I leap in and ask Professor Burci a question? You've talked about the IHR's responding to the actions that Dr. Grohalam Brundtland implemented for SARS, but David Fidler actually says that SARS was an opportunity to deploy a lot of the strategies which were already being developed by people like yourself in the context of developing the IHRs. So obviously it could easily be both, but I'd be interested in your comment on that.
But as you know, the Health Assembly had asked the Secretariat to revise the IHR in 1995. So, and we had many years, I joined in 1998 and I wasn't really part of some of that work. And that was remarkably unsuccessful. We didn't find a good alternative that was realistic also for developing countries to implement. So That's why the Secretariat started doing things without a legal basis in response to needs, because you had emergent diseases. There was a need. There was a need for guidance, there was a need for alert, there was a need for response. And that without a legal basis. I remember distinctly when Dr. Brundtland put out those travel advisories, that my boss, the then legal counsel, was terrified. Because what happens if China and Canada come and challenge us? What is the legality of what you're doing? You're damaging our economies on what basis? We didn't have a legal basis. But what is interesting is that nobody came and challenged the legitimacy of what we're doing. They challenged the merits. They were saying, no, everything is under control. Please don't do that. But there was not an outright challenge to that self-assertion of emergency power that really responded to needs rather than emergent from a codified legal basis. So it's a chicken and the egg, if you want. But to me, I think it's realistic to say that SARS showed the amount of emergency power that could be self-asserted in the right circumstances, which was a bit of a legal vacuum, or political defensiveness on the part of China, of interest in strengthening that instrument on the part of Western countries, maybe for ulterior motives, like security, biosecurity, and so on. So to me, it was an alignment of the stars that unlocked the will of member states to, we need to really revise the IHR, but at the time was a golden opportunity to put checks and balances and contain the power. So whether it was successful or not, I don't know, but I think that was the dynamic as I saw it at the time.
So can I ask another question, Nithin? The IHR's 2005 allows the Secretariat to receive information, act on information from other sources other than the country. China has a law, apparently, in the health department, which says that people may not speak publicly about health issues without going through the National Health Commission. Was that law introduced specifically to undercut the provisions of the new IHRs?
I don't know. I really don't know. I mean, given the level of political and social control in China, I think it goes way beyond the IHR. Control of information is rewriting and that's frankly what China is doing now. They are rewriting and controlling the narrative. They are erasing any evidence of what could have happened. So even though Trump is rattling the sabers and threatening God knows what, you need evidence for what happened and didn't happen. That evidence doesn't exist anymore because the level of control of China, including having its own internet, which is disconnected by and large to the rest of the net, allows it to control the evidence and the information. But that to me goes way beyond health. It's part of the political model of China.
WHO has an office in Beijing. Presumably they were much closer to what was happening in the early weeks of January this year.
Maybe that's speculative. I cannot say. I know that the people from the country office went to Wuhan mid-January. And so together with the Chinese authority, that was not like a surprise inspection, like on a nuclear facility. So I don't, they saw what they saw and they made their own assessment. But exactly what happened, I'm sure there will be plenty of investigations after things come down. And I hope that will bring a measure of clarity, because that's what we need. Otherwise we feed into conspiracy theories, into disinformation, into pure weaponization of public health, and that's so negative. But again, to me, the power of China to control the narrative is unmatched. And so I wouldn't hold my breath for what can come up.
So that, may I ask further on this issue? So there is one of the criticism on WHO is that it's a contradictory recommendation of one way WHO is saying social distancing, and at the same time saying no travel bans, or even on late as 13th or 14th of March, also WHO criticized countries for imposing travel bans, saying that there is no evidence on travel ban. So some people are saying this is sort of mutually contradictory recommendation. And you also, I think, I read, Professor Burci, you also mentioned that at one point of time, WHO needs to explain this thing, you know, to in a way to prove itself, its transparency and accountability. So I would like to hear from you further on this. And also, Professor Legge, you can also look at historically what is the evidence on travel bans and or travel restrictions and epidemic. Thank you.
Yeah, I know this is a bit of a messy story with COVID. I must say, and this is anecdotal because I'm not a public health person, but I sat in quite a number of emergency committees, or H1N1, Ebola, polio. There is a very, very entrenched consensus in the public health community that travel restrictions don't work. That's not instrumental, that's not political. It's really a very deep consensus that the disease will reach you anyway because you cannot seal yourself from the rest of the world. It's absurd. Because it creates a false sense of security, because it creates more damage than benefit in disrupting trade, is affecting the possibility of bringing aid to affected countries and so on. It's very, very entrenched. And so I'm not surprised that that was like the default at the end of January. And the problem to me is that the emergency committee has been silent until the end of April. So what happened in the meantime was not under the IHR. So there was an element of contradiction. If you look at the emergency committee statement on the 30th of April, even though begrudgingly, it basically admits, acknowledges that there are travel restrictions, but they have to be targeted, they have to be temporary, they have to be proportional, they have to be based on evidence, and in particular, they cannot be a panacea in isolation, and that I totally agree. They need to be part of a package of measures. They basically had to gain time to do other things, to get better prepared. And so I think that WHO has come around a little bit and has acknowledged that that's what countries are doing. And under certain circumstances can have its logic. On social distancing, if you look at what WHO has said, and I can't say that I read all the guidance because there are hundreds of pages on the WHO's website, I haven't seen a clear endorsement of physical distancing. WHO talks about contact tracing, talks about quarantine, but quarantine are individual measures. They can be small community measures, but I don't remember WHO even addressing the whole locking down of entire countries, like what's happening now in the world. And I wonder why. Maybe because it doesn't want to take a position, or maybe because the IHR are fundamentally about international spread. They're not about domestic management of diseases. So maybe it felt that that was a bit outside the remit of the IHR. But I found it striking that, as far as I can see at least, it doesn't really expanded on the model of social distancing that has been adopted in the last few months.
Can I say that I share your skepticism about this evidence about social distancing? I'm persuaded that social distancing and travel restrictions may have had an impact, but I have not seen anything which looks like evidence about these things. I make the point that the first International Sanitary Conference in 1851 was called by the French Minister for Trade, not the Minister for Health. And the trade people have been driving this for a long time. I'd like to say I'm not sure that this obsession with not interrupting travel and trade is a feature of public health culture globally, but it clearly is a feature of WHO culture globally. I think that and I think it would be a good thing to call it out and ask for the evidence.
Professors, we have a few more questions in the chat box. So the last one was from research scholar Paul from CPPR India. And there is another question probably public health scholars like Gopakumar sir and David Legge sir can answer. This is from Saurabh Sinkanapalli. He's asking about whether there can be some sort of compulsion to have a certain minimum amount of investment into the national health systems on the side of WHO. Probably not as a percentage of GDP enough, but probably taking an average of GDP or 2 to 3 years and finding out certain minimum target amount fixed for that. I believe Brazil has already have some sort of such decisions in their law.
There's nothing which is going to happen internationally. It's up to the people of those countries to demand that adequate funding of their their health system. But of course, adequate funding of a health system is statistically incorporates private sector funding, and as Dr. Gopa has said, and Professor Burci has said, that the neoliberal model of a competitive health insurance market providing funds for a private sector service delivery, it doesn't deliver quality or safety or efficiency, and it certainly doesn't work for public health.
So I just would like to add, so the WHO does not legally making any binding commitment from countries to make such an investment, but generally they say 6% of the GDP as a public investment is required to have a robust, is desirable. But if you look at the example of Sri Lanka, it was doing wonderful work in the public health system, around 3%, around 3% of investment in the GDP, and now they are enhancing it to the target is to reach 5%. So I am saying is that what we require is not the investment. What we require is the public investment in the health system, which at least we should have to the level of WHO recommended 6% of the GDP. Thank you.
Professor Burci, there's a question on dispute settlement process of WHO, which has not yet been evoked once in the history. So this question is like, is there any alternative way available to resolve such disputes arising amidst these situations? Is there a better course of action which the US could have followed apart from apart from defunding WHO?
Yeah, that's coming out as a pretty controversial topic, and it's the first time, at least from what I remember from other emergencies, and that obviously has to do with China's role in all of this. So the IHR has a fairly loose provision on settlement of disputes, which is either up to the countries concerned to choose whatever means of a peaceful settlement they want to use, or to submit the dispute to the Director General, which can act like a conciliator or provide good offices, or optional arbitration. Countries should declare that they accept it. No single country has done that, so that's dead letter for the moment. Or if there is a dispute involving WHO, so something against WHO, it will be brought to the Health Assembly. So it will be the collectivity of states parties that will address that point. So in a way, these are some of the not terribly implausible mechanisms to settle international disputes, but until now they have not been used. Why? In my view, because disputes that emerge during an emergency, let's just use COVID as an example, largely trade disruptions, countries restricting or prohibiting export of pharmaceutical ingredient, including India, by the way, that for a while stopped the export of pharmaceutical ingredients, active pharmaceutical ingredients. Or protective equipment, or ventilators, and so on, or imposing sanitary conditions that disrupt transport and trade, so you have food rotting at the border and people going hungry inside the country and so on. These are not the disputes that lend themselves to lengthy judicial procedure. If I have this problem now, I'm not sure the arbitration that will give me an award in 3 years makes much sense. So I think the challenge would be to try to find mechanism that address quickly, practically, and pragmatically these kind of problems of disruptions when they emerge. And I would have thought that the Director General, using the Director General as a kind of really a conciliator of sitting countries around the table, even discreetly, behind the scenes, not under the scrutiny of the media, and basically compare risk assessment and see whether there is an element of coordination, that to me would be pretty powerful. And I would say, I would see a much more aggressive role on the part of WHO in proposing this, in basically going to countries rather than waiting for countries to come. Because countries can have a political deterrence to do this. They don't want to look weak. They don't want to admit that they made a mistake. So I think there has to be a creative search for mechanisms that are not terribly antagonistic, but they are very practical in addressing quickly and diffusing quickly these kind of situations. Whether then countries will litigate, yeah, sure, maybe. But certainly outside WHO, I don't see why countries should litigate under the IHR trade disputes. They will go to WTO. They will use their own free trade agreements that all have settlement of disputes clause. They will use investment panel arbitration. So there are other forums that compete with WHO, and they are probably more effective when it comes to trade, investment, economics, and so on. To me, what WHO would have an edge, would have a comparative advantage, is trying first to coordinate with other sectors, and second, to try to diffuse at a practical level these kind of disruptions.
Can I just throw in to the issue of the US-China relationship, that people may well be aware that the US has been a major funder of the Wuhan virology laboratory, and there has been a great deal of research undertaken at that laboratory, which is American funded, in collaboration with US virology experts. And critical to that is this issue of growing viruses in ways that might cultivate what's called a gain in function, and which has been declared a moratorium in the US. So there was a moratorium on this particular approach to viral research in the US, which led to increasing funding of Chinese laboratories. So how that gets, I mean, Gopa's called for transparency, and but how that sort of thing gets researched and brought into the open in the context of arbitration or further investigation is hard to it's hard to know.
Professor, we have already reached 3:30. Am I allowed to take 2 more questions, or should I stop it? It's up to you.
Yeah, please take it 2 more.
Okay.
Yeah, sure.
So this is from Professor Shanu Narayan, who is a member of Indian Society of International Law. She has asked whether states or WHO must seek reparations from China for the violation, or do you think human security angle is also necessary while combating COVID-19?
Maybe the Iraqis could seek reparations from the US for weapons of mass destruction.
Or Afghanistan, for that matter. So yeah, I wouldn't go too far into that. I mean, frankly, this issue of apportioning responsibility, I'm sure there are thousands of lawyers in the US and elsewhere. They are sharpening the knives and looking for any possible forum where to attack China. When you have trillions of dollars on the books, the temptation is very strong. But I'm not sure, as strong as the temptation can be, and as it can be legitimate to be upset with China, because I also find it hard to believe that one person eating a pangolin in Wuhan may have caused this mess. Still, I'm not sure that we go very far. I think there's to be another approach. If there has to be accountability, I think the accountability will have to be beyond China, because many countries just sat on their hands and waited until the pandemic exploded, like the US, like the UK, like some European countries, and so on. So if there is a responsibility by China, there is also a responsibility by these states that have been basically passive when they should have looked at what happens there and taken early. So we have to be careful about seeking responsibility, because then there can be also co-responsibility.
I think I do agree that, of course, the whole criticism is the delay of international declaration of international health emergencies. Delayed. Of course, we need to look into that issue, but we also look at that. How many of these countries actually followed WHO's other instructions or recommendations, especially on social distancing and testing? So how many of these countries followed it? Okay, even UK and US was thinking of building herd immunity till second week of March, and suddenly then they, then they started following some of these recommendations of WHO. So while we look into some of these criticisms, we need to look for evidence, but at the same time, we also should look at what really these countries were criticizing WHO, what really they do as soon as they got the recommendation from WHO.
One last question, that is there any scheme to push global pharmaceutical R&D measures, or probably a global R&D treaty by WHO?
I think the sort of picture is bleak because what WHO has done on the research and development front is a new initiative called ACT, Accessing COVID Tool Accelerator. This is consisting of 3 partnerships. So one for vaccines, one for medicines, and one for diagnostics. So this is the beaten path. Okay, this is status quo. WHO has actually, they do have a division called R&D blueprint. The R&D blueprint actually looked at the R&D gap. Oh, not only R&D gaps, all the research gaps related to COVID. The knowledge, they identified the knowledge gap. They have working groups, and they have working groups are meeting, and they are updating this knowledge gap at frequent intervals. So we expect WHO, using its own constitutional mandate as a coordination function of international health, will take it forward and creating an online platform wherein which the various research happening across the world can be coordinated in a better way. What is the purpose of the coordination? Purpose of the coordination is reducing the knowledge gap, prioritization of the R&D, and eventually push speedy development of shortening the time of product development. But instead of that, WHO did is a product development partnership and completely pushed outside the WHO. So the WHO is only one among the players, and it's not a leading player. It's not even a lead coordinator of any of these platforms, and it is by and large driven by foundations and EU. So EU had a conference. So another important criticism about the WHO's role in the product development partnership like ACT Accelerator is that there is no clarity about the intellectual property protection of the R&D outcome, whether it will be protected through patent or it will be left like a copy left license, whether it will be a IP left form, so wherein which you can really copy this technology and increase the local productions and decentralize the production as much as time you can and increase the availability of the new products. So I don't think so that is coming through. And I got a chance to look at some of the leaked draft resolution, which is also silent on the R&D front. So that way, that part, WHO is sort of a failure, and it is throwing the line of maintaining the status quo. That you can link at that. There is no mention about one of the weakness of IHR. You can say not weakness, one of the areas where IHR is silent also on product development, but that does not mean that WHO do not have a mandate. Does not have a mandate. WHO has a very clear mandate on R&D. If you look at the constitution.
With that, let me conclude. Is there anything to add on, Professor Burci or Legge? No. Right. Thank you. Thanks a lot for sharing some valuable moments with us. And I would like to bring to your attention that for us, the Kerala student community of international law, it has become now a challenge to learn international law in South. We were once the part of the prime of international academics in India when Professor Alexandrovich was there. At this point of time, almost all our discussions are concentrated at Delhi. And so this kind of, listening to people who actually negotiate the treaties, who work with institutions are a very small, rare experiences for us. And somehow we are blessed to have you all here. And this is also a very auspicious day for Chinmaya Vishwavidyapeeth because it's the birth anniversary of our beloved Gurudev, Swami Chinmaya, and the blessings of Gurudev has come up as what I call in the form of real 3 gurus before us speaking about international law in this day. Thank you. Thanks a lot.
Many thanks to you. Thank you very much. Bye-bye. Best wishes.
Goodbye.